Hello, I'm Dr. Deepika, one of the doctors in the antenatal clinic today. May I confirm your full name and age, please?
Hello, doctor. I'm Emily Carter and I'm 17 years old.
How do you want me to address you?
Call me Emily.
Emily, I gather from your notes that you're currently 23 weeks through your pregnancy. Are you currently studying or working?
No, I'm not doing anything.
Okay. Let me assure you that this is a safe space and whatever we discuss here today will remain confidential unless I'm worried about your safety. So, how are you finding the pregnancy so far? Is there something that you're particularly worried about?
I don't know, doctor. I mean, I don't have anywhere to live else to live, so the situation is quite difficult for me.
I'm really sorry to hear that, Emily. We will look into that and take all the necessary steps to keep you as well as your baby safe. Before that, is it okay to ask you a few questions to understand your situation better?
Yeah, sure.
Is it a planned one?
Not really.
In that case, are you happy to continue the pregnancy?
Yeah, we are happy to continue.
How has the pregnancy been so far?
It's been okay.
Is there any particular reason for late booking and for missing couple of appointments? Because I can see that you missed your fifth month scan, which is a normally scan.
Uh, I don't know. I'm not deliberately neglecting my pregnancy. I have missed my periods and a few appointments after that because life has become difficult and disorganized.
That's understandable, Emily. Going through pregnancy can be difficult. Don't worry, we are here to support you. Is your partner supportive of this pregnancy?
Yeah, he is.
And how about your parents?
No, I don't have any good relationships with my parents, and I'm not living with them. In fact, at the moment, I'm staying with my boyfriend's sisters at her flat. So that's why I don't really have a right place to live, and I'm worried about money and also about housing. So there are many things to look into.
Okay, at the moment you're not working. What about your partner?
He's doing some private time work. That's it. Part-time work. Sorry.
So there are financial difficulties as well.
Yes.
So what are your future plans for caring for the baby?
Of course, I want to keep the baby, and but right
Okay,
now I'm not sure.
okay. I'm going to ask you a personal question. These are the routine questions I ask everybody. Do you feel where you're living at the moment? Do you feel safe?
Yes, I think so. I'm safe.
Okay. Any concerns regarding your partner, any controlling behavior, any physical or emotional abuse?
No,
Okay. And maybe if you don't mind me asking, do you smoke or drink alcohol at all?
I drink occasionally, and I also occasionally smoke as well.
Can you tell me roughly how many cigarettes you smoke in a day and how much alcohol you consume?
I occasionally have some wine, and about smoking, I used to smoke around 5 to 6 cigarettes per day.
Mm-hmm. Any recreational drugs?
I used to smoke weed, uh, but I have cut it down because I did not have enough money to purchase it.
Mm-hmm. When was the last time you smoked a weed?
About 6 months ago.
Since then, have you had any withdrawal symptoms or any cravings?
No, I'm fine. I'm not smoking that anymore.
Okay, that's good to hear. Regarding smoking and alcohol, now that you're pregnant, have you thought about quitting or stopping them? I'm not trying to be judgmental here. I'm just trying to understand your situation better.
I don't know. My mom had two pregnancies, and she was a chain smoker during those pregnancies. And me and my sister turned out fine. So I don't know. Why I should. I really don't understand why should I quit smoking now.
Okay, I understand that. Apart from weed, have you ever used any other recreational drugs, injected drugs?
No, nothing else.
Does your partner smoke or drink alcohol?
Occasionally, yes.
Any medical conditions?
No,
Any surgeries?
no, doctor.
Any allergies you're aware of?
No,
And your weight to height ratio?
23.
And your blood group, Emily?
B positive.
Okay. And any reservation to blood transfusion?
No,
Any low mood in the last few weeks or months?
Nothing as such. I'm fine otherwise.
Okay. Have there ever been a safeguarding concerns raised about you or your family or involvement of social services?
No.
Okay. Thank you for sharing all of this with me, Emily. Is it okay to examine you in the presence of a chaperone? I would like to check your blood pressure, measure your weight to height ratio, and examine your tummy and listen to the baby's heart sounds.
Yeah, that's fine.
Emily, as far as smoking is concerned, there are few things I would like to discuss with you. I understand that your mother smoked during pregnancy. Both you and your sister were born healthy. From your perspective, it may feel that smoking is not a major issue. However, every pregnancy is different. Every baby responds differently. Some babies may appear healthy despite getting exposed to smoking, while others may not get affected. I'm not here to judge you, but my role is simply to give you the information so that you can make the best decision for yourself and your baby. Be it a active smoking or a passive smoking, it is not considered safe during pregnancy as it contains thousands of chemicals and that can reduce oxygen supply reaching your baby and that can put an increased risk of having a miscarriage. It can affect baby's growth inside the womb, increase the chance of low birth weight, premature delivery, and baby may even require admission in the NICU. It may also increase the risk of future health problems in your child in the form of asthma, learning difficulties. And as far as mom is concerned, issues like bleeding during pregnancy, your afterbirths might get separate early from the womb. And I'm really sorry to be telling you, sometimes it may even increase the risk of baby dying inside the womb.
Oh, that's a lot.
I'm not trying to scare you, Emily. I just want to make sure you have all the information. The good news is that you can stop smoking at any stage during pregnancy. It can still improve the outcomes for both you and your baby. We have a lot of support available. We can put you in touch with NHS Stop Smoking Services. We can discuss nicotine replacement therapy, which will help with your cravings and make quitting easier. It comes in different forms, such as patches, gums, lozenges. I'll give you the written information on the same. What are your thoughts about that?
Okay, I'll think about it.
And as far as alcohol is concerned, any amount of alcohol is not considered safe during pregnancy. It can affect baby's growth, development of brain and nervous system. We can also put you in touch with alcohol de-addiction programs as well. And you're not alone in this journey. You will be looked after by a team of specialist doctors, including my consultant obstetrician, midwife, GP, health visitor, smoking cessation specialist, and of course, safeguarding team. And I would like to arrange your anomaly scan as early as possible. However, since you're 23 weeks pregnant already, some views of the baby may be more limited. And I have reviewed your blood results, and I can see that your hemoglobin is on the lower side, and vitamin D levels are also slightly low. So I'll prescribe some iron tablets for you, and give you written information on the iron-rich foods. And we will repeat your blood count in 2 to 4 weeks of time. And I encourage you to continue with your vitamin D supplements. Is that okay with you?
Yeah, that's fine.
With your permission, I would like to refer you to our safeguarding midwife and social support services so we can identify any what additional support you may need during pregnancy. We will also refer you to housing support services. I will write back to your GP. They will help you apply for local housing assistance and they may be able to arrange for temporary accommodation while long-term solution is being explored. And there is also financial support available, including maternity support schemes, start maternity grants, free NHS prescription, all that we can definitely help you with. Any questions so far?
Uh, yeah, what about vaping, doctor? Can I use e-cigarettes instead of smoking?
So, as such, e-cigarettes are not completely risk-free, but they do not produce tar or carbon monoxide like cigarette. So, if using an e-cigarette helps you stop smoking cigarettes completely, yes, it is generally considered as a separate, safer option. But we can discuss the e-cigarettes and nicotine replacement therapies through our NHS Stop Smoking services. Is that all right with you?
Yeah, that's fine.
Please continue to stay away from the cannabis and other recreational drugs, and we'll assess your risk factors for blood clots. If necessary, we can discuss blood thinning medications. We strongly advise you to attend all your future appointments, and we will also arrange a named midwife who can coordinate with your care and guide you throughout the pregnancy. I'll involve my consultant, document today's consultation, right back to your GP. Any questions?